purpose of this presentation is to explain the nurse's role with patient advocacy and policy making. The American Nurses Association, ANA, defines nursing as the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. Nursing care extends far beyond providing physical care to patients. There is much work to be completed in the background. Patient advocacy is one of these background areas. Advocacy is defined as using active means to take a stand and bring forward a position, cause, or an issue on behalf of someone else. Patient advocacy means respecting patient rights and the patient, and ensuring that the patient has the education to understand treatment and care needs. Nurses can advocate for an individual, a family, a community, or a population. The nurse can act as a voice for a patient, for nursing peers, or for the nursing profession. Examples of patient advocacy include asking the physician to allow a dying patient's dog to come visit the patient while in the hospital, educating family about the amount of support they will require after discharge from the hospital, educating the community about the importance of vaccines, or lobbying for healthcare staffing and resources. Nurses realize there are major problems in the healthcare field. In order to fix or correct the problem, a policy may need to be made. A policy is a course of action that affects a large number of people and is inspired by a specific need to achieve certain outcomes. A great example of a policy is the Patient Protection and the Affordable Care Act of 2010. I will use this policy to explain how the policy-making process works. To make a policy, first, a problem must exist that requires a policy. An example would be noticing high costs of medical insurance resulting in families not being able to afford health insurance. Next, research is required to get a better idea of why the problem exists. Information is gathered from experts, consumers, and relevant literature. Looking at data on the cost of insurance, speaking to people who do not have health insurance, and learning about health insurance are all examples of this step. Then, all of the solutions must be examined and the best solution is chosen. A cost-benefit analysis looks at finances as well as what people will this policy not help. An example would be consumers who simply choose not to sign up for health insurance because they think they do not need it. Finally, the policy is ready to be put in place. This step requires a lot of pre-planning. President Obama signed the Patient Protection and the Affordable Care Act in 2010, putting it into place. Therefore, before this could occur, nurses became involved explaining what would take place when this policy was implemented. Lastly, the policy must be examined and evaluated to see if changes need to be made. For example, when the Patient Protection and Affordable Care Act went into place, many citizens were finally able to afford health insurance. This created problems for hospitals, such as understaffing and patients going to the hospital or to the ER just for regular or routine needs. These problems need to be evaluated and corrected. Nurses have many ways that they're able to be involved with policymaking. They can share their experiences, serve on policymaking committees, research consumer needs, and/or serving in elected positions. It is important for nurses to become involved in the policy-making process because they are experts in the healthcare field, some even working directly with patients. Nurses understand their patients' needs and can recommend a course of action. Nurses need to speak up about staffing and shortages. The only way to make a problem known is to use your voice. The ANA plays a large role in policymaking. We have members lobbying in Washington, D.C., and have members serving on the ANA Political Action Committee. The ANA promotes the rights of nurses and works to correct issues affecting nurses and the public.